What procedures are in place to hold these C&P examiners accountable? Can you elaborate on that? Can you, please, to follow up, Mr. Walls?
Perhaps Pat can help me on this, but the oversight from the quality folks, the oversight in terms of their performance is relayed through the entire system and reviewed repeatedly. We look for outliers, and we are very aggressive when we find outliers. We want to go hold them accountable, but really what that means to me in most situations is they're working very hard. They need some help. It may be that it's not their fault that they've fallen behind in some way. So we go in, educate them, tell them how to use the fee-basis system, how to use the contract system. We sometimes even send people from my office to actually do exams. We developed a locum tenens program so that we can air assault individuals directly into that program who are qualified when we lose someone who is unexpected.
Thank you. Mr. Murphy, regarding the number of examinations by the VHA clinicians, what are the cancellation and no-show percentages for fiscal year 12 and 13?
I don't have those numbers in front of me. Perhaps Ms. Murray does.
Sure. The cancellation rates when our office stood up was about 18% and has been holding at about 18% for many years. Since we have jointly begun to look at the flow of the work between the VHA and VBA, we have reduced the cancellation rate down to 14%. We have revised our policies to clarify guidance, and any cancellation rate that peaks or is out of the norm, we immediately contact the facility, take immediate actions, and if anything comes to our attention through anything outside of our data, we immediately take actions to assess what the issue is and implement corrective actions.
Is it common practice to call the veteran, to remind the veteran that an appointment will take place?
So
common practice within the VA?
So for C&P, our process is that when the 2507 exam request is received at our medical center, there's a requirement to contact the veteran by phone.
Okay. Is that no-show, if there's a no-show or a cancellation, is that included in the veteran served category?
Can you repeat the question, sir?
Well, if there's a no-show, let's say a no-show, is that included in the veteran served category? Well, first of all, why don't you answer this question? What does constitute as a veteran being served by VHA clinicians? I attempted to contact the veteran, made contact with the veteran, appointment scheduled, appointment completed. What is the definition of a veteran being served?
Sure. That represents the 2507 exam requests that have come over for VBA has been exams completed and it's closed out in the Capri system and returned back to VBA. That's what that number represents. Everything that has been completed.
Okay. Mr. Murphy, VBA is now tracking the difference between the electronic date stamp from when the request is submitted by VBA and when it is returned to VBA as complete. Is anyone from VA using this information to track the overall number of days from when the veterans submitted the claim?
Yes, VBA's clock never stops. From the time I identify there's a need until the rating decision is done. Our clock on the timeliness for exam doesn't stop. We talked about cancellations. If there's a cancellation or a delayed appointment or any of the other things that happen, I still have a claim that has to be done in less than 125 days. So in order to drive that process, we sit down with VHA every Friday and we dig deep. And sometimes the conversations aren't so pleasant, but that's exactly how it needs to be. We, the VA, have a mission, and we have to deliver on it. And we have candid, frank conversations based on the numbers to drive the performance of the whole organization.
So you're saying that when the veteran submits the claim, there's tracking between when the veteran submits the claim and when the claim is completed, not just when it's stamped by the VA.
Correct. In years past, there were people involved in the process. There's been steps put in place now where it's done by triggering events in the system. So we've taken the ability away from the individual to date stamp and do things. The system tracks it. When a 2507 request for examinations is completed and we hit the enter button, that gives me the ability, without the individual's ability to influence, to look at that and tell when exactly that examination started. On the other side, VHA completes the examinations required, returns them to me, and when they show up back in my box, there's another trigger that's electronically, and we can come back, and we do go back and measure the spread between those two dates. That's the 24-day number average that you're hearing.
All right, thank you. My time has expired, Mr. I yield back.